What people have to understand is recovery works, and the standard by which they set out recovery is so high that if they say, look, if we're going to put money in a program that doesn't give us 100% recovery or 90%, then it's not working. Well, if we applied that standard to education, to the Defense Department, to anything else, we wouldn't even come close to meeting that standard. The truth of the matter is, when people are in recovery, they're not out on the street. They're not hurting themselves. They are not hurting the public at large. They are not doing damage, and they are not committing crimes, those of whom are addicted to drugs, which cost a lot of money, and they have to go out and find the means to supply them. And so beyond that, there are a number of Republicans, and Democrats who support recovery, and there are a number of programs that work very well. I'm familiar with your Watershed program. It's first rate. There's a number of them all across the country. We should be supporting them more, not less, because it is not a lifetime sentence. There are tens of, you're going to honor a congressman here who was forthright about the fact that he had a serious alcohol problem, that he is a recovering alcoholic, and that he has done an incredible job for a long, long time. But it's hard to do it by yourself. Hard to do it. As Dr. Cleaver up at Yale said a long time ago when I went to see him, over 25 years ago, he said, Joe, about 10% of the people recover from a see God syndrome. They run over their cat when they come home that they love, they're about to lose their son or their daughter, they're getting divorced, and that's enough. But for 90% of the people, they need help. This is a disease of the brain. They need help. And recovery programs are better and better and better and better. We should be funding them, and we should be supporting them.
We'd like to get the word out there. We estimate between 10 and 18 million people who are in long-term recovery, not use drugs or alcohol for over a year.
Well, that's true, and what you have, and you still have another 16.5, 17 million people abusing alcohol, another 19.5 million people abusing drugs. So the point is, without recovery, can you imagine? Without this help, can you imagine the state of affairs we'd be in? And we can do better and better and better. And I'm absolutely committed to identifying those recovery programs and methods that work the best and supporting them.
Do we have any shot at parity or beating back managed care?
Well, I hope so. I think people are beginning to understand that we're kind of in the category in the way people have treated mental health. If someone is unrelated to addiction, if someone is suffering from serious depression, we say to them, get better, man. You break your arm, we'll take you right to the hospital. Depression is a disease. Addiction is a disease. It should be covered.